Hello, I'm Dr. Gerald Chodak, and this is prostatevideos.com. In this video, I want to give you an overview of radical prostatectomy for treating early stage prostate cancer. This is an operation that can be done under a local or a general anesthetic, and it can be done in 4 different methods. But in each of them, the goal is to remove the entire prostate along with the seminal vesicles and a piece of the vas deferens. In some cases, using some of the methods, we may also remove several lymph nodes to check for cancer. The operation is done in about 1 to 3 days of hospitalization, and usually men will go home with a catheter or a tube that's inside their penis and comes out through the tip to allow the healing to occur, and it drains the urine in the meantime. So those are the general factors about the operation itself. The real issues have to do with who should have it and what questions patients should be asking. You should be aware of several things. Number one, there was a recent well-done study comparing radical prostatectomy to watchful waiting or no local therapy. And at the end of 12 years, there was no significant difference in survival. So some men may be benefiting, but overall in the 2 groups, there wasn't a significant benefit. And that has raised a lot of concern amongst people, suggesting that maybe surgery isn't necessary for a lot of the men who get that treatment. The questions that you should be asking your doctor about your type of tumor are, what are the odds that you are likely to have an improved survival? What are the odds to get a recurrence of your cancer after the operation? And then, of course, there are very important questions to ask about complication rates. You want to know what are the complications that can occur with your surgeon, and given your age, your health, and the type of cancer you have. So complication rates really vary across the board, and it certainly does appear that more experienced surgeons will get better results. So it's reasonable for you to ask your doctor how many they do. Do they do 20 or 30 a year, or they do a lot less than that? It appears that having done fewer than 20 per year results in a higher risk for complications. Another thing you'd like to know is, what are the specific complication rates for your doctor? The complications that can occur long-term include problems with erections, problems with urinary control, hernias can develop, there can be a urethral stricture that can develop, and there can be problems with pain or discomfort with following orgasms. The rates or incidence of those complications vary depending on many factors. And so the best thing for you to do is ask specifically your doctor for his or her results. We do have questionnaires that can be used to assess how patients are doing with the various treatments. Some doctors use those surveys, many doctors do not. If they don't do those surveys, they're going to give you an estimate of their complication rates, which unfortunately are not very reliable. So if your goal is to get the best result possible, you might seek out a very experienced surgeon who keeps results so that they can inform you what to expect. The other thing that's important is how often they occur, and what about the short-term complications, which also can vary. A recent study suggested that there might be a smaller incidence of short-term complications using the robotic approach compared to the retropubic approach, but that study also can be criticized for a number of reasons. So where does this leave you? How do you decide what to do? It's important for you to realize it's not how the operation is done, it's really who should do it. So when you decide, or you're trying to decide, do you want a robotic approach, a retropubic approach, what you really want is an experienced surgeon, someone that does a lot of these each year. This is not an easy operation to do. And so one can't assume that simply because someone is trained as a surgeon that they'll necessarily get the best results possible. Hopefully we'll get more information in the future, but you should realize that this is certainly one of the options. It's been around the longest. There's no ability to say that it's the best treatment for localized prostate cancer, But it is fair to say that if all the cancer cells are contained inside the prostate gland and you take out that prostate, then you should be cured of the disease. The reason we don't cure all men with radical prostatectomy is because in some cases the cancer cells may have already left the prostate gland. And so even removing the prostate won't get rid of those cells that have spread. At the end of the day, this is one of the options to consider if you have localized prostate cancer. And maybe one day in the future we'll get more information comparing this treatment to the other options available. Until that time, you should become aware of all the pros and cons of all the options available and all of the different ways of doing this operation before considering which treatment is right for you. Hopefully this video and the others contained in the website will provide you with helpful information as you choose what your treatment will be. Thank you for watching.